Hey guys, it's Dr. Giles here with Aspire Chiropractic, and today I want to talk to you guys about something called lower cross syndrome. This is by far one of the most common causes of low back pain that I see in my office, and most patients have never heard about it. So let's talk about it a little bit today, and let's start off by talking about the four main muscle groups involved. All right, we've got our abdominal muscles, our glute muscles, our low back muscles, and our hip muscles, our hip flexors. And you can see here that they're forming a cross pattern, and that's where the name comes from. But really what's going on here is an imbalance between the muscles in our low body, specifically our abdominal muscles and our low back muscles, as well as our hip flexors and our glute muscles. Now I'm labeling these here as tight and weak. So what you see is the low back and the hip flexors are much too tight, and our abdominal muscles and our glute muscles are way too weak. So this is causing an imbalance in our body. It causes things like our pelvis to shift forward, it causes a big curve into our low back, and it's what leads to a lot of pain that we see aching in the low back area and in the hip flexors. Now, what can you do to help tackle this problem? Well, first and foremost, I would suggest going and finding a really qualified chiropractic office such as ourselves so we can do a thorough exam and make sure we're ruling out any other issues that might be going on in the spine. But we're going to focus on adjusting the low back. We're going to focus on adjusting the hips and the pelvis to make sure everything's in alignment. And then from there, it's a pretty simple fix. We're going to focus on these muscles that are too tight by stretching them, or what we might call softening, stuff like self-massage, using foam rollers. And with the weak muscles, the most important thing we need to be doing is we need to be activating and strengthening these muscles. Because when these muscles, the glutes and the abdominals, are strong, it helps to take a lot of the work and load off of the low back muscles and those hip flexors. One thing you can be doing is making sure that you're getting up from your desk or doing some stretches when you get out of the car after you've been sitting and driving for a long time, because those are the main culprits that you see causing this type of condition. Staying in a sitting flexed position causes those hip flexors to get tight, low back to get tight, and because we're sitting on our butt and not using our core, those muscles start to turn off. Additionally, I see it a lot with athletes that are in the gym. They might not have as much experience knowing which muscles they're working, and they end up using way too much of their low back muscles when they're doing things like squats and lunges, or way too much of their hip flexors when they're training their abs. So if you think that you might have something like lower cross syndrome going on, or you've got some general aches and pains in your low back and you want to get it checked out, come on in here to Aspire Chiropractic. We'll take a look and we'll get you all fixed up. Here at Aspire Chiropractic, we're ready to help you when you're ready to be your best.